There's a story that I just processed it about 20 minutes ago about a black doctor getting health care. And I want to play this story. And the reason I want to play this story is it's not for our crew here solely, but for the other people that are going to get this on podcasts and otherwise. Because there are groups of people in this country that are fearful of vaccines because they know that they've been the underdogs with vaccines, that they know they've been used for experimentation. There are people in this country that seek health care at a late time because they know that they never get comparable health care, or sometimes the health care they get is not beneficial. And here is this black doctor. Look at what happened. This is a black doctor. She understood what she was reading on her MRI, on the CAT scan of her lungs. She understood it. She's dead. And when I saw the program, I was sort of upset at the system, but I was also upset at her. I'm going to explain what I mean after I play the video. Check this out, and then we'll take it on the other side.
The treatment and death of a black doctor in Indiana is creating new calls for justice over the racial disparities in the pandemic. According to the COVID tracking project, black people are dying at nearly twice the rate of white people nationwide. At least 52,000 black Americans have died from the virus so far. That is 17% of deaths where race is known. Those numbers are underscored by Dr. Susan Moore, a family physician and black woman who died of the virus after posting a video to social media saying she faced racist treatment by a white doctor at an Indiana hospital.
They're not going to treat me here properly. The CT went down a little bit into my lungs, and you could see new pulmonary infiltrates, new lymphadenopathy all throughout my neck. And all of a sudden, yes, we'll treat your pain.
Her story inspired an op-ed from other black doctors in the Washington Post asking America to say Dr. Susan Moore's name. Joining me now is one of the authors of that op-ed, Dr. Camara Phyllis-Jones. She's a senior fellow and adjunct associate professor at Morehouse School of Medicine, and she's also a former president of the American Public Health Association. Doctor, thank you very much for joining us. So this woman's experience, this doctor's experience, and this message that she left on social media, as you know very well, resonated with a lot of Americans because they have felt that way when they've gone through the American healthcare system, that they have been treated differently. Black people have been treated differently than white people. How do you go about trying to address that issue?
Well, thank you for having me. The first thing to do is to recognize that racism exists. It exists in the healthcare system. It exists in our justice system, in our educational systems. So the first thing is to name racism, to believe Dr. Moore's cry for help when she was naming racism as it occurred to her. And then once you do that, then you have to identify the mechanisms. In this case, there's no accountability. There are, few black doctors. There's just a disrespect. And once you identify how is racism operating here in the Indiana University hospital system, are we treating people differently by race? Be unafraid to look at your data, not just patient by patient, but look over 6 months. Look at each individual practitioner over 6 months. So you have to acknowledge that racism exists and then think, it's not that if we fix it here in the healthcare system, we're done. Racism is woven into the fabric of our society. It's foundational in our nation's history. It continues to exist, and it has profoundly negative impacts on the health and well-being of the whole nation. We need to wake up out of our racism denial and understand that racism exists, and then roll up our sleeves to become actively anti-racism.
If you are at a hospital and you feel that you're not getting fair treatment because of the color of your skin, what do you do?
Well, you try to go through the mechanisms they have. So if they have a patient advocate or the like, then you try to get them in. Often family members, in the time before COVID, when you could have family members there, would be able to advocate for you because they might notice things that you wouldn't notice. But then you need to keep going higher and higher within the administration to make your case known. And sometimes because you're not in a position of power, then you're almost at the mercy of the system. So what we need to do is make sure that we never put people in those positions, that the system itself should be self-monitoring. Are we doing equitable care? It shouldn't be on patients to advocate alone.
It shouldn't be on patients to advocate alone, but while you have the power to advocate, you must advocate. Look, this is important for everybody, irrespective of whether you're black, white, blue, whatever. But there is a specific angst that black people have in hospitals. I've experienced it. My wife has experienced it, and I have made sure. Let me give instances of. I said earlier why I was sort of upset at the doctor, not in a negative way, but in a way that she was too passive. She went on social media and said, "They're treating me badly. I see infiltration in my lungs. I see these different pathological things that are occurring to me that warrants better treatment, different types of treatment." That was not awarded her. In that message that she put on Facebook, which is a powerful instrument, she should have said, "I need all of you to advocate for me. I am at this hospital. I am a doctor. This is what's happening. I want you to contact everybody you can, including the media, to come out here and ensure that they are going to give me the care that I need, because it is currently at this time. It is about to happen. I am about to get worse. I am about to die." The media that she used to tell her story could have been a clarion call as well. And one of the things that I have with many people that are aggrieved, black people, Latinos, and so forth, when things happen to them, they say, "You're treating me badly. Stop treating me badly." I don't want that anymore. I want folks to do something about having been treated badly, and do it in an immediacy, right away. I wanted her to go out there and said, "This is what I need you guys to advocate for me now." Anybody that is listening to Politics Done right now, there are people that have sent me info and say, "Hey, what's going on here? Is there something that you can do? I am homeless." I've thrown that out to them and said, "Contact XYZ." I have contacted that. This woman need not have died. This is a dead woman that need not have died, because the Facebook family could have been her advocate if she had given a command. "Do this for me now, numero uno." Secondly, she should have raised bloody hell. She could talk enough to say, "Get me a supervisor in here now." And by the way, if you don't get it here, by the way, I've already contacted the media to tell you that the kind of treatment I am getting is the minority treatment in the hospital. That is what needed to have been done. We have to be self-advocates. I remember being in the hospital, walking around with the IV connected to me, and walking around when I couldn't see a doctor. I remember when my daughter was born, and they had my wife was really sick. We didn't know she had lupus then. It was just called preeclampsia. And I ran around that hospital and got that damn doctor. I didn't get them. I was around there searching, finding, not waiting for something to happen, but making something happen. We all have to be our brother's keepers. We all have to make things happen, especially in a capitalist society where you are just an agent of profit. Remember that. You are just an agent for profit. And if you want, you have to advocate. You have to have those. We have to be a team advocating for each other. This woman need not have died. We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.